So a dental implant is a treatment that's being used to replace a missing tooth. And if a tooth is missing, and in the end, of course, you don't want an implant, but you want your tooth back. And the tooth that you put back has to be put on some kind of foundation. And that's that's what a dental implant is. So it's an artificial root. It's a screw you put into the bone. And once this has connected to the bone and properly healed, you can put the artificial tooth, which is what the entire treatment is about, on top. So the replacement of a tooth with a dental implant is something that works in a very sequenced way and is very well researched. So in general, what you do if the tooth is still there is that you remove the hopeless tooth, then you wait 3 months for the bone to heal. After 3 months, you place the implant, the artificial root. Then you wait another 3 months for this to heal and connect to the bone, and then you can replace the tooth with a crown that's being put on top. This is something, as I said, it's very well researched and you know it works. The big disadvantage here is that the tooth is missing for, in general, 6 months' time, which is not that bad if the tooth is all the way in the back of your mouth. However, the more you go towards the front, this of course is a big problem. And that's why there's also like a special treatment. It's called an immediate implant placement. In this, we remove the hopeless tooth and place the implant immediately in the same surgery and put an artificial tooth on top right away. To make sure it connects, this is a restoration that can't be used. So the tooth will be a bit shorter, but for you, psychologically, the tooth is always there and it's only one surgery. And after 3 months, this implant has also connected and we can put the final crown. So I don't have a dental implant myself, so I can't speak of my own personal experience, but in our office we placed thousands of implants over the years, and what we can say is that it's a medical intervention that is not that painful. So during the surgery itself you don't feel anything, and afterwards the patients usually take one painkiller medication and that's it. Patients are usually scared of surgeries, and the question is, how bad is it afterwards? It usually depends a lot on how well everything heals. And when you talk about replacing teeth, usually the worst appointment is the appointment when the tooth is being removed, because you have an open wound and this can hurt and also bleed, and that's causing all of these problems. For the implant itself, you do a surgery, but you drill a hole in the bone and afterwards you put a screw into this hole that fits. It's like a cork. So everything is really well sealed and there's not much bleeding. So that's why in general it's not that painful. So placing a dental implant is a medical intervention. So it's something we take very seriously. And to make sure we achieve a long-term stable result and nothing goes wrong in the surgery, we do a 3D X-ray and a 3D scan of the teeth before every implant that we place. And this allows us to plan the position of the implant before we do the surgery on the computer. And there it's important that we place the implant in a way that no neighboring structures are being damaged. And of course, also to make sure that we get a good treatment result in the end that will work and that is good, well cleanable. Because if you imagine, for example, 2 teeth that are like this, and you place your implant not in this angulation, but more angulated like this, since the crown has to be screwed in this direction, you will get a lot of food impacted all the time in these areas to the neighboring teeth. And to make sure that's not something, a problem that our patients have, we do this 3D planning. So it's in the right position, both surgically or anatomically when it comes to the surgery, and also that it can be used in a good way. So we plan the final result, and then we create a surgical guide using a 3D printer to make sure that the implant in the surgery is being placed exactly in the spot that we planned in the beginning. So when you have a tooth that needs to be replaced, there's in general 2 different ways to approach it. One is to put a dental bridge, which is a restoration that's lasting on 2 crowns on the neighboring teeth. So you have to remove parts of the neighboring teeth, put a crown on top, and then the tooth that's missing is hanging in between. It's like a bridge that goes over the water. That advantage here is that it's something that we know works very well, just like an implant, and that you don't need any additional surgeries. And in case the teeth next to the gap also need to be crowned anyway because they have big defects, for example, this makes a lot of sense because you're doing everything, in an easy way. If the neighboring teeth have nothing, then of course it would be not that advantageous for the teeth to remove a lot of them to put the bridge. In that case, the implant makes a lot of sense. So the maintenance of an implant is just like with a normal tooth. In the end, your implant should be like every other tooth that you have in your mouth, both when it comes to the cleaning and also how you use it and how it feels like. The only difference that you have between an implant and a natural tooth is that the root itself, in this case the screw, is smaller in diameter than the normal tooth. So if you use floss there and you go underneath, it's smaller and you can go more towards the bottom, but that's okay. So you're not damaging anything there. Apart from that, everything is exactly the same. So dental implant is a very well working and very well researched way to replace a missing tooth. The big advantage to other treatment methods is that you treat the individual problem. So for a bridge, for example, if you would put that to replace the tooth on the neighboring teeth, you have to grind a lot of these neighboring teeth down. That's something you don't need with the implant. The other advantage is if the neighboring teeth, for example, have some kind of uncertainty, maybe a root canal treatment, some kind of thing that's, in the open, then it's also good if you can replace the tooth with a dental implant because you reduce the overall risk because every risk is being treated individually. It's just a local solution to a local problem. My name is Sebastian Horvath. I'm a dentist and certified qualified specialist for prosthodontics. I love being a dentist because it's a great combination of doing something medically, which has a big impact on our patients, and also doing something with your hands. So I also give courses for other dentists, and I wanted to create a slide in which I, try to tell them that when you do something new, you should focus on stuff that really brings you forward, like a rocket. And, I created this slide and I loved it so much that today our office is full of rockets.